Hello, my name's Dr. Geraint Preest and I'm a GP in South Wales and a member of Coeliac UK's Health Advisory Council. I'd like to talk to you about celiac disease. Celiac disease is a condition that's a lot more common than people think. Around 1 in 100 people in the UK have celiac disease, but only a fraction of these patients are actually diagnosed. In fact, we think around 500,000 people are walking around with celiac disease and they don't know it. How does celiac disease present? Well, celiac disease is a lifelong condition triggered by exposure to gluten. So people have gluten in the diet. This is found in wheat products and it makes them unwell. They may get gastrointestinal symptoms such as abdominal bloating or constipation or diarrhea, or they may just get a vague feeling of unwellness whenever they're exposed to gluten, or just feeling generally tired. The first protocol, if you think you've got celiac disease, is to see your GP, and your GP will want to take a history from you to find out if this is celiac disease or whether your symptoms are due to something else. One of the things about celiac disease is that it can masquerade as irritable bowel syndrome. The symptoms are very similar. In fact, we think around 1 in 4 patients with celiac disease were earlier misdiagnosed with irritable bowel syndrome. So if you think you've got irritable bowel syndrome, it's really important that you're tested for celiac disease to rule this out. Testing for celiac disease initially is by blood test. Now the important thing is that you need to be eating gluten for this test to show up. So if you've stopped eating gluten, the test will come back negative even though you have celiac disease. If you've had the test done with your GP and the test has come back positive, suggesting celiac disease, the GP may request further investigations with a specialist, and it's important that you continue to eat gluten until all of these tests are done. Well, I hope you found that information useful. If you'd like some more information about celiac disease, then please visit the Coeliac UK website.